All right, ladies and gentlemen, we're going to get started. It's 2 o'clock, and if you can locate a spot on one of the benches, and also if you're on the committee, come on up and join us.
What's going on, Jesse?
We're going to. We're missing. It's one thing to miss your senior members. It's an entirely different matter to miss your newest members.
They stand outside the door, right? Sign an autograph, Chairman.
I think that.
Send the sign it off to peruse the hall. Pick them up. Listen to the man.
Thank you, Colonel. He's got his handcuffs with him. So, all right. Better yet, can I borrow that taser?
We'll be discussing that.
That's a good idea. I like where you're going, Colonel. I like where you're going. And so it's one thing to have members stroll in a little bit late. It's another thing to have your new members showing up late. Are they clear? Yeah, we needed to make sure we did a little background check on our newest members, and they say I think they're thumbs up, so they're good. Yes, sir. That's why you've been out there. Welcome to the Public Safety Committee, gentlemen. We've got some great new members here, Representative Michael Gravely, Representative Bill Workheiser. Here are our newest members. Let's give them a round of applause for making it on this. Well, we're all. Thank you all for coming, and apologize for the packed room. We have a hot seat, and this is kind of a hot box too. This room gets warm, so we're going to try to roll through this very quickly. We've got an agenda and a timetable. We'll try to stick to that, and with your help, we'll do that. I encourage members of the committee to ask questions. You have a track sheet in front of you. We'll be going by that track sheet, and I'll try to help guide the discussion as we move through these various items. So let's start off first with our Department of Community Supervision. We have 15 minutes for them. So if Matt Ogles can come up, our budget director. The commissioner is at a funeral of a close and dear employee to the department. So I want to make sure that you recognize that he would be here otherwise.
Yes. Thank you, Mr. Chairman.
Go ahead and start off, please.
I'll start off with items 1 and 2 under sections 8.1, 8.2, and 8.3, or 18.1, 2, and 3. This is our request for a 20% raise for our officers. This raise was announced by Governor Deal in September in an effort to recruit and retain quality law enforcement personnel. Our department is unique in that we require our officers to have a 4-year degree, which has made recruiting and retaining our officers difficult due to competition from the private sector as well as other law enforcement agencies. However, since the announcement, we've seen our average monthly resignations drop by over 50%. We've also been able to hire an additional 120 officers since September. This raise was implemented on January 1st of this year, and this request of funds is, the request is for the last 6 months of the fiscal year. Our next request is on line 18.2.4, which is for a little over $1.1 million for the replacement of 33 vehicles that are past the replacement cycle, and an additional 12 vehicles to our fleet, which will allow us to reach our desired goal of 1 vehicle for every 2 officers. We found that this is the best ratio to maximize the use of the cars. For our officers, the vehicle is essentially their mobile office, as they spend most of their days visiting offenders at homes and or in the community. And because of this, having a reliable vehicle is paramount to their safety and productivity. The next item is 18.3.4 under the Governor's Office of Transition, Support, and Reentry. And this simply just changes GOTSR from being an attached agency to a program within. Last year, the governor issued an executive order appointing our commissioner as the director of GOTSR, and then subsequently SB 367 passed last session, which codified this. There is no operational impact to this change, as we've been working as a cohesive unit for over a year. And finally, there's a statewide adjustment for DOAS's merit system assessments. And this simply adds funds to match our budget with their annual billings. I believe that's all the changes.
Okay, Mr. Director. let me ask a couple of questions. Going back up to just to clarify for the public and the committee, the 20% pay increase for law enforcement, that is inclusive of the 2% proposed pay increase across the board by the governor. Is that not true?
From my understanding, the officers will only get the 20%, and the 2% is for civilian personnel within our agency.
Very good. Thank you for making sure we got that clear. And then also on the retaining of criminal investigators, 18.1.2. Now, what is the differential there that you're using to maintain this? Because I would assume that they would also be participating in the 20% pay increase.
So those raises are 20% as well for those investigators. I think it's just a different caption because they have a different job title.
Okay. All right. And then when talking about the vehicles, isn't it true that the department had originally requested a one-person, one-vehicle ratio, but that has now been trimmed back both internally and with the assistance of both this committee and the governor's office to a two-person per vehicle?
Yes, sir, that is true. I believe parole used to have more of a one-to-one ratio, but when we merged, we found that one vehicle for every 2 officers, we utilized vehicles more effectively.
Okay, very good. And then moving down to the Ghoster line, this is 18.3.4. On this one now, is it my understanding now that the Governor's Office of Transition Support and Reentry is really now essentially blended into the Department of Community Supervision, so this doesn't exist anymore pursuant to that legislation we passed?
Yes, sir. Their operations have come into our field operations, so they work as one unit. There'll still be a separate programmatic budget, but the operations are all one.
Should we not change the budget language here in the section? Instead of saying the Governor's Office of Transition, should it just not be Transition Support and Reentry?
Sir, I'm not sure if I should make that call, but
I'm asking for your. I'm asking
yeah,
you for
I believe it's
your
still the governor's.
professional budget
I
opinion.
believe it's still a governor's initiative, and that title still remains for the program.
Okay, it's still a governor's initiative that's now just housed in
Correct.
community supervision.
Yes,
I'm
sir.
okay with defending the governor.
Well, I know you are, but I have a different constitutional perspective on that. So. All right.
Young man with the future in the office.
Always have to have one. All right. Okay. Well, with that, questions from the members committee.
I got a quick question.
All right. Let me go down. Al, let me put you on. Go ahead.
I don't have my figures, but what's the difference in this year? Any increase can be proposed for the transition, support, and reentry?
Yes, sir. That'll be in fiscal year 18. There is
Okay.
a request for that.
Can be a request?
Yes, sir.
All right, sir. Not at liberty?
No, it's a request for 5 community coordinators to backfill grant-funded positions. So
Okay.
those positions already exist, and it's just funding because the grant's expiring next year.
Mm-hmm. When you come back to talk about 18, I have some real questions moving forward. Okay?
Yes, thank you.
All right.
Yes, sir. Thank you, Mr. Williams. Yeah, Representative Williams, we're going to focus right on the 17 budget so that we'll be efficient for everyone's time, and I appreciate you doing that as well. Let me get Mr. Caldwell. Chairman.
Thank you, Mr. Chairman. Sir, I'm looking at departmental administration and the 20% increase for law enforcement officers. Is the commissioner and deputy commissioner considered law enforcement officers or civilian personnel, as you said?
No, sir. Our commissioner and assistant commissioner are not included in this. This is some of our directors who are housed in our admin program but are still sworn officers.
All right, so we're not talking about the administrative people. We're talking about the law enforcement officers.
Correct. It's like
All
our director of, our internal investigations director and people like that.
Okay, thank you.
Mr. Earl, wasn't it true that that the department has decided to maintain? I think it's in its requests. They've generally been flat budgets, and then also there's not been a request for any administrative pay increases from this department since its inception.
Yes, sir. That is correct.
Okay, very good. Wish that were so for other departments. No, I'm kidding. All right, let's any other questions for Director Ogle? All right. Thank you very
All right.
much. We
Thank you, Mr.
appreciate you
Chairman.
being here.
Thank you.
And send our regards and our well wishes to the commissioner and the family of the employee that
Will do.
has passed
Thank you.
away. All right. We're going to move on to the GBI, please. If Director Keenan is available, we'd like to have him come up and speak to us. It's on section 30, page 6 of your track sheet.
Mr. Chairman, members of the committee, I'll be speaking to the additions to the amended FY17 budget, the new funding that is in the governor's budget. First item is 30.3.2, and this is to increase funds for 6 forensic scientists and their operating costs for the first 3 months, for the 3 months remaining in the fiscal 17 amended, and then we'll be coming back in FY18 budget. But that total amount for that is in here somewhere. Anyway, it is the 3 months. The 3 month salary is $162,000, and the equipment and the operating costs for them is $704,000. Now, this is based upon the fact that we have a backlog in the crime laboratory as of today is 23,000 cases that are waiting to be processed through the lab system. Though that backlog is created by staffing levels. We operate as an assembly line, and when you don't have the workers on the scientific bench, then the work backs up. Also, what has eviscerated this, our current status, and made it worse, is that we've had an 11% increase in the number of requests for scientific analysis this year over last year. Some of the disciplines have a much higher percentage, but overall in the lab, 11% increase in the number of cases that the lab is being asked to work. There are many reasons for that, but primarily it is that in today's criminal justice world, scientific evidence is expected in criminal cases for prosecution and is needed in investigation. And I believe that as the state continues to grow, then the lab system will also have further demands on it. These 6 scientists will give us a jump start in moving forward with getting them trained so they can do work. It's important to remember that it takes us 8 to 12 months to train a scientist, and during the time they're training, of course, they're not performing work. In the second item, it goes in conjunction with the crime laboratory, is 30.3.3, and these are one-time funds to purchase 4 vehicles. And what we buy for the crime lab are Ford Fusions. Works out very well. These are pool vehicles. The scientists use them when they go to court. They use them when they travel for training. Other than that, they remain in the pool. There is one-time funds for the replacement of forensic lab equipment, and that is 30.3.4, and that amount is $1,015,000. It is extremely expensive to purchase and for replacement of crime lab instruments, but they have a limited lifespan, and we constantly have to go through a replacement process, and this will take care of the needs at the present time. And we'll be purchasing with that items such as comparison microscopes and mass spectrometers and a bunch of other equipment that I don't understand what it's used for, but the scientists do. And then we also have under 30.3.5 one-time funds for purchasing the equipment for the GBI headquarters morgue expansion. And as I spoke at my last presentation before this committee, last year you appropriated $6.5 million in bond funds to construct and expand our morgue at headquarters, and we're in the process of doing that. This $600,000 will equip that new morgue addition with the office space and the new equipment that is needed for the morgue. That expansion will allow us to have 50 bodies in and 50 bodies out, totally increasing our capacity up to. Currently, we'll be right at 125 bodies. We're grossly out of space now, and so this will complete that project. That $600,000 will. Now, next item is under the Regional Investigative Services, which is our investigative division, and that is 30.4.1. And this is to increase funds to pay for the 20% pay increase, which the governor had recommended. And currently, we have 269 sworn personnel in the investigative division. And the cost for that is $2.804130,000. Now, I don't point out an example of how important this is. Prior to the announcement of the pay increase, of the 20% pay increase, in our recruitment efforts in 2015, we had 429 applicants who tested for the special agent positions. We have a competitive exam, which is the first step in the employment process, 429. After the governor's announcement of the pay increase, proposed pay increase before the legislature, we had 748 applicants tested. So that's an increase, that's a 74% increase in the number of applicants just based upon the fact that there may be a sizable increase forthcoming. So that speaks to itself. That salary increase will allow us to have a starting salary for special agents of $48,593. And then when you get up into the 5-year span of a special agent, they would make $70,514. And at 15 years, it makes $77,742. So that is a competitive salary for law enforcement in this state, and also is competitive with some of the things we have to deal with the federal agencies. Additionally, under 30.4.3, these are one-time funds to replace 12 investigative vehicles, 4 bomb vehicles, and crime scene response equipment. And this is our bomb vehicles. We have them arranged so that we have to replace them constantly, as you can imagine. They have wear and tear on them. In our crime scene response equipment, we operate in a modular system so that we have the chassis we bind chassis because we've got the modular containers already constructed, and we just move them from the wore out chassis and put them on the new ones. Works out very well for us. And sir, that is the FY17 amended budget. I'm glad to answer any questions.
Yes, sir. Thank you, Director. We appreciate you being here. Question about the morgue expansion. I wanted to thank you for the invitation to come to the groundbreaking. When you invited me and you indicated there would be shovels and dirt, I wasn't sure if I was going to be a good start,
work crew,
or part of the work crew. You know, that the old joke about lawyers at the bottom of the ocean. So I thought I wasn't sure where this was going, but I appreciate the opportunity of being there. And then I also know that the potential for a morgue expansion or a new morgue and lab in Savannah is also, I think, a key priority for the agency going forward in Savannah. So we'll be looking at that when we get to the 18 budget. The new scientists that you have here, the 6 forensic scientists, so these are going to be located in headquarters. They're not going to be transferred to Savannah. Is that correct?
That is correct. They'll be headquarters based. And in the Savannah laboratory, we have an existing laboratory down there currently, and all of those staffing would go to the new facility, and then we would hire as we go forward for Savannah, because currently this will put us out of space in headquarters.
And then on line item 30.1.1, that is that part of the merit-based adjustment for employees that the governor had mentioned in his budget of 2%?
Tanya, is that correct?
30.1.1?
Yes, ma'am.
This is a merit system assessment. It's a charge that's paid per employee.
Okay.
For merit system.
All right.
So it's not tied to the pay rates. No.
It is not. Okay. Is that reflected? In this would be, so the 2% is going to be part of the 2018 FY budget. Is that correct?
Yes, sir.
Okay. All right. Good. Questions? All right. Vice Chair.
Director, first of all, thank you for being here, and not to be morbid about it, but I want to pick up about this morgue thing also. That's pretty much been an ongoing problem that we've talked, you and I have had some conversations about.
Yes, sir.
And you feel pretty good about where we are now, or do you think we need to be looking ahead? I mean, to where we don't get to where we were?
Yes, sir. The problem has been twofold. number one has been the lack of doctors. But you gave a pay raise, General Assembly gave a pay raise to our doctors 2 years ago. That has helped us retain those which we have. In the FY18, we'll be talking about additional funding in the governor's budget to do further increase to help recruit and then continue to retain. That's one thing, is the number of staff. I think we'll be well as we work through this. The other problem was lack of space. And when we don't have the space at the headquarters morgue, which is our largest, and we do autopsies also in Savannah and Macon, but they have limited capacity. When we're not able to receive the bodies, then the coroners have to keep them at the local level until we can call and say we now have space for you to bring the body to us. With the morgue expansion, that's going to solve that problem.
And it's just on a personal note. Just this past summer, and first of all, shout out to Scott Dutton because he's been great to help me. But I had two situations where we had a young man who went missing, supposedly, and then they found him in a wreck. Mm-hmm. And, you know, the family's been worried to death for a week before they finally found him. And then all of a sudden, a lot of people don't realize this, that has to be looked at by you guys.
Yes, sir.
And they're wanting to have some closure on the thing. Right. And they had, 2.5 weeks before they could get closure because of it. No fault to y'all or whatever. And then another thing with the suicide. So hopefully we're going to be eliminating some of this.
Yes, sir. We're making, this state is making progress through your help. Currently, we do 80% of our autopsies have a report completed and released to the coroner and the family within 90 days. 80% in 90 days. That is reasonable. Other cases get to be complicated, and particularly when we have the drug overdose cases or we have children who've died. Those can be very complicated cases. But we also compound, it extends the time out when the coroner has to hold on to the body for 4 days because we don't have the capacity because it can't come to the lab to be autopsied. The morgue expansion is going to solve that because we'll be able to handle 50 bodies in, 50 bodies out.
Great. Thank you for your work on that.
Yes, sir.
Thank you, Mr. Chairman. Director, getting good to see you, and thank you for your work.
Thanks, sir.
Yes, before I ask my question, hold my invite to the morgue here.
Yeah.
Just hold that.
Yes, sir. Okay. You're welcome anytime to visit.
No.
And if you show up, we will give you priority.
I appreciate how kind you are, but I'll take your word on them all. Listen, you mentioned 26,000 cases down from a forensic standpoint. How many days did that equate to? You're behind. You said you're behind 26,000 cases.
It depends on the discipline that is in. If it is in something like trace evidence, that could be 9 months. Other cases would be, what we consider a case in the backlog is a case that's been in the lab and has not been worked in 30 days. After that, it goes into the backlog. Some cases, if we have an increase in toxicology scientists, we can speed up that type testing so it's not, we're doing more. But it's any case over 30 days.
Okay.
Other questions from members of the committee? I had a follow-up question, Mr. Director. Last year, the House and Senate appropriated monies for 2 fusion analysts, I believe.
Yes, sir.
Are those positions filled?
They are. Yes, sir. They're filled.
And just would you explain to the to the committee and to the folks here and that may be listening what the Fusion Center is, just in brief?
Fusion Center is an entity which brings together several different agencies, and they share information, and the Fusion Center is responsible for doing exactly what it said, fusing that information so that we can make assessments and can draw conclusions and then provide that information to an investigative agency, pass it on to the federal agencies if they're responsible for the type level case. We have representatives in our Fusion Center from the Sheriff's Association, Chiefs Association, FBI is there, Homeland Security, of course our agency, Emergency Management, Homeland Security Agency, and everyone works together. 'Cause the Fusion Center it's responsible for taking all of this information that's pushed down by the federal government and extracting out that which is important to the state of Georgia and seeing that it is then shared with persons who have responsibility for acting on that.
Good, thank you. Chairman Powell.
Thank you, Mr. Chairman. Director, I don't have a question, but I want to give a shout out to y'all. Not that I don't always think a lot of all of the officers across the multi-agencies, but I think this is particularly important because I never was as proud of a agency and some of our manpower. We had an incident up in Livonia this past summer, a very gruesome murder, and the GBI agents from Athens came in, and they were young agents. And it was it was very heartfelt. But these guys came in, and we had a beloved citizen up there who was viciously beaten to death, basically tortured. And the local law enforcement came in and started looking initially and thought they had the lead. They felt like they knew who it was. Well, immediately within hours of your agents coming in from the Athens division came in. And these were two young officers, two young investigators. And within a matter of hours, they had already changed the direction of the investigation. The chief came back and they broke this case like within a day. And the chief of police in Livonia, a 30-some-odd-year veteran, I've never heard a local officer, a local chief, praise any group as much as he did, and basically said that they would have been on the wrong track, but that these young officers came in and he said he couldn't keep up with them. And what a great job they did. And I just want to give a shout out to those officers and to you and to the division for the good job that y'all are doing.
Yeah, thank you, Chairman Powell, and also thank you for getting with the local officials and recognizing those young agents. They do work hard. Of course, they're young; they can work those long hours. But, thank you, sir.
Mr. Director, just a couple other follow-ups from the 17 budget last year passage, House Bill 751. There was also a line item for 5 new scientists. I assume those are filled.
Yes, sir.
There was also a line item we put in 5 toxicologists. Those have been hired.
Yes, sir.
Okay, and then we also had 22 new investigators. Have those all been filled?
Yes, sir. They've been all the positions that you funded, that this General Assembly funded last year have been hired. Those scientists that were hired are going through training. The agents they've been hired. Some of them are working, and the others are getting ready to go to complete their training.
Okay, very good. Okay, we'll see any other questions from members of the committee. Thank you, Mr. Director, for being here today.
Thank you.
If I might just take a point of personal privilege here, I wanted to recognize my dear friend and my former Congressman, Matt Collins, who's sitting up in the front row here. He served my area well, and we appreciate it. Thank you. On to the next item on our agenda is going to be with the Criminal Justice Coordinating Council. Executive Director Jay Neal is here. CFO Nathan Branscombe is here as well, and Stephen Hatfield, Deputy Director, is also present, I believe. And I think we may have just a little bit of time to hear from Executive Director Spahas and Brian, also Tyson, about the $3 million allocation for the e-filing in the criminal justice system. So I'm going to let Jay, if you go ahead and take it over from here. We'll get to those points in a minute. Thank you.
Thank you, Mr. Chairman, and ladies and gentlemen of the committee. It's an honor to come before a committee that I served on myself for a few years, and I appreciate so much the work you all do, and it's an honor to stand before you and represent the Criminal Justice Coordinating Council. The Criminal Justice Coordinating Council was established in 1981 by statute, and several legislative charges were given to the council. Most of those around coordinating among criminal justice agencies within the state. So to just give you a little bit of an idea of what we do with that coordination, the Criminal Justice Coordinating Council has 2 primary focuses that we are known for. One is as the state administering agent for federal criminal justice grants, and we provide grants to our partners around the state, and we also provide victim services and victims compensation. We have 629 active grants that are distributed to 240 state, local, and nonprofit entities with a total value of $92.8 million that we grant and that we manage, and that we help ensure that those funds are being expended appropriately around the state. As part of that, we're the primary funding agency for victim services programs such as victim advocates, child advocacy centers, domestic violence shelters, sexual assault centers around the state. In all, we'll spend some $60 million for victim services this year, in addition to approximately 18 to 20 million that will be utilized to reduce the financial burden of victims of violent crime through our Crime Victims Compensation Program. We also work very closely with the judicial system in administering the State Accountability Courts program in partnership and cooperation with the Council of Accountability Court Judges. We also administer the Juvenile Justice Incentive Grant programs. We have 27 council members, and many of those council members are actually here today presenting on behalf of their agencies. We appreciate the support from all of those criminal justice agencies around the state. We also have individuals that are a part of boards and agencies that are involved in the criminal justice and victim areas as well. In addition to that, we administer a number of state task forces, including the Human Trafficking Task Force, the Sexual Assault Response Team, and the Civil Legal Assistance Network for Victims of Crime. So you see the coordination of all the services and the community justice agencies that we work with around the state. That coordination among criminal justice agencies is reflected in our amended fiscal year 17 budget. There are basically two line items that are in this budget that is before you. Those line items are 30.5.2, which is a $3 million project to provide funds for a statewide criminal justice e-filing initiative. This is an initiative of the governor's office that it involves a number of criminal justice agencies. As you're aware, data systems are diverse around the state, from circuit to circuit and from agency to agency, and a lot of times those systems are not able to communicate. One of the things that we found over the course of the last year or so, in 2013, we passed legislation that would result in open cases that have not been shown with a disposition, those records being restricted, and by going to the clerk's offices and looking at some 42,000 open cases that were subject to being time restricted off, it was found that 47% of those actually had a conviction. So there's a real need to have this kind of seamless communication and cooperation among our state agencies to make sure that the records are accurate and that we're able to provide the kind of criminal justice services that the people of Georgia expect from us as a state. We do have, as you mentioned, Chuck Spahos and Brian with the Prosecuting Attorneys Council, Brian Tyson with the public defenders that are with us today. They have been involved with this project from the beginning. And they are more prepared, I think, to talk to you about the history of the project. But that is one of the projects that we have in the amended fiscal year 17 budget. Another project that we have is a $500,000, that's 30.5.3, to provide funds to develop a single sign-on e-access portal. And again, this goes to the need to provide opportunities and access to criminal justice records. Where this really comes into play is with accountability courts and juvenile justice. Let me just give you one example of why this is important. If a juvenile is in court in, say, Gwinnett County, and it's the first time they've been in court in Gwinnett County, but maybe in Fulton County they've got a pretty good history. That judge in Gwinnett County sees that individual as a first-time offender because they're unable to see what has happened with that juvenile in Fulton County. It's important that we have an opportunity for these diverse systems, the judges operating under diverse systems, to be able to have a single sign-in access point to where they can get that information from around the state so that they're able to appropriately deal with those individuals that are before them. That's one example of why this single access point is an important priority for us moving forward. Sir, I would entertain questions if you all have questions about these two requests for amended fiscal year 17.
Questions from members of the committee? Let's let me ask a real quick question, or just pose a thought to make sure that this is something we're contemplating, and we're protecting the privacy of those involved in if there's an e-access portal as you described it, Mr. Executive Director, then I'm presuming that those records would be closed records and not subject to anyone gaining access to those records that would not be lawfully authorized to do so.
Security is paramount with this e-access. That's correct.
Okay. Chairman Ballinger.
Thank you, Mr. Chairman. I just had a quick question about the integration, because I know Chairman Willard has filed something, at least on the civil side, as far as mandating some sort of holistic, universal e-filing system. So how does that coordinate with that on the criminal side? Because I guess I'm concerned that our clerks are going to have 17 different terminals for, juvenile court and superior court and state court, and it seems duplicitous to me to kind of keep reinventing the wheel, so to speak. So can you speak to that?
No. I have people who can speak to that. How's that? Does that sound pretty good?
Let's have those people come up.
Yep.
Welcome, people.
Thank you. Thank you, Mr. Chairman, members of the committee. We did not know we were people for this project until yesterday afternoon. But let me say this, and let me start by answering Representative Ballinger's question. This is exactly what that is coming from. We finally gotten in Georgia where we do have a bona fide civil filing. Most of you have had some familiarity with that. That has been funded and taken place over the past 5 or 6 years. This is traveling on that backbone of that. The concept would be a single method of communicating both between the prosecutors and the public defenders, the clerks and the sheriffs, so that it is entirely the same in each circuit. So it is replicating what's been done for civil, for criminal. And quite frankly, as we talked strategically over the years about that was because criminal is so much more complicated than civil, and there's so many more players. It was contemplated that we do the framework with civil, and then we come back and bring criminal in. The first meeting I ever went to discuss this was 22 years ago, when we were discussing then how complicated and what was wrong with data and the adjudication data that's not getting properly fed to GCIC.
That's shared data also with the Sheriff's Department and the courts.
That's correct.
And clerks and probation officers. Will community supervision also have access?
That's correct.
Okay.
So the pilot itself is and it's been strategically put in counties that have got all of the technology players that we would then need to replicate throughout the state. That's been the problem, is there's so many vendors of data, and to have what we call exchanges of that data. So what we're supposed to be able to do, our understanding and quite frankly our opinion, is we'll be able to then take that and replicate it throughout the state with the players.
Where is that pilot project going to be located?
I knew that question was coming. The counties that have been tasked with that include
Dawson County, Bartow County, and Forsyth County, I believe, are the three that are
Hall
doing
and
the pilot.
Gordon.
And Hall
That's the
and Gordon.
five.
Yep.
And Hall and Gordon. And that actually represents 2 counties that are in the public defender system, and it's also an opt-out county that's going to allow us to create the ability for local attorneys to have login and access, and also do that exchange from private attorneys to our system tracker that the majority of the district attorneys are.
And just so folks understand, those counties that are included within that pilot area that are opt out are those that have opted out of having a public defender's office, so that they're providing that by local private counsel. Is that correct, Mr. Tyson?
That's correct, Mr. Chairman, and the intention of having the pilot with one county that was not a participant in the public defender system was to recognize that we do have private lawyers that interact with the criminal justice system across the state. We want to make sure that we prepared and built the system in such a way where those lawyers can also do filing into this system. The goal is ultimately we're going to have a dramatic increase in the efficiency. Anybody who's practiced in civil e-filing knows how much easier that is than having to go down to the courthouse and file things. And also just the efficiency of the information transfer, of us being able to get the client information from the sheriffs more quickly, hand our information off to the prosecutors more quickly. That'll speed that process up and hopefully add a lot of efficiency to the overall judicial system.
It's very gracious of us for them to opt out, and then we let them in. That's good.
They're always welcome.
I represent one of those counties.
Yeah, I know. I'm nudging up here. Okay, sorry.
No, you already actually anticipated my question, and as far as like the opt-out counties like mine, how they would be able to integrate. Is it a cloud-based system?
I believe there's going to be a central, I don't want to get too deep into the technical details that I don't quite understand, but my understanding is there will be a hub that will basically do a handoff between the various entities.
Mm-hmm.
The design is whatever your existing case management system is. For us as the public defenders, we use a central database. Prosecutors use Tracker. Different clerks use different vendors. We want to make sure that those vendors, basically all of those will talk to a central hub that will hand the information off to the appropriate system, whatever system that might be in each agency that's involved.
My understanding is you still maintain your data the way you maintain your data now,
Mm-hmm.
but now you can exchange that data with everybody else that has an interest in it.
Okay.
What Director Tyson was telling us is that he has people to explain this.
We represent smart computer people that have those answers.
Exactly.
Other questions from members of the committee? Okay, just as a courtesy, this request came in very late to the committee, so we're spending a little bit more time on this. We had previously had some committee meetings prior to session beginning. This is a new request. We're spending a little bit of time on this, and I hope you'll appreciate us bearing with us on that. It's helpful to try to get those things in advance so that we can do that and vet them out a little bit earlier, especially when you're dealing with an amended budget in a short time frame to respond.
Is this $3 million? Is that just a startup cost, or what is it going to be annually?
Yeah, that is the pilot cost, so that is the five counties mentioned to fully integrate all of the players in those counties, and then that then gives us the footprint to take it statewide. So that's
It's a
the pilot.
one-time cost.
Yes.
Correct, and it's not a matter of where the scale up is this amount per county. When you're building the integrations, we're connecting with counties that have existing vendors, and so once you've built the integration between a particular vendor and the hub, you don't have to rebuild that every time for each county that uses that. So the overall cost will not be scaled based on that.
Where will the hub be located?
So that's.
It's a cloud. It would be probably a cloud-based system, so it would probably be.
In the cloud?
Yeah,
It's
it would be.
it's a classified cloud?
I think you'd have to talk to Director Keenan about that, where exactly it would be located. He could probably tell you, but then he'd have to tell you.
But GTA is going to maintain.
GTA is where to be located. Yes.
So this is an example of that coordination. The GTA has an enterprise service bus. GBI will be where the programmatic portion of it is housed. So again, it's a coordination among criminal justice agencies.
All right, other questions? Okay, great. Thank you, gentlemen, very much. Appreciate
Thank you
your
very
time.
much. Appreciate
Thank you
it.
for being here. Okay, we are moving well through our agenda here, which is good. We're going to hear from the Department of Corrections next. Commissioner Greg Dozier is here today, I believe, to present. So I'll just give him a minute to get to the podium.
Good afternoon.
Good afternoon, Commissioner.
I appreciated the time at the last meeting and a chance to go over the dashboard, and due to brevity, As requested, we're just going to hit the major changes from our last meeting to this meeting from the workload adjustments. Looking at the tracking sheet, the first adjustment is 19.2.1, and if you guys could, if we could talk about 19.2.1 along with 19.8.1 and 19.8.3. Those three items are all related to the law enforcement pay raise. That pay raise totals for all three programs $900,000, $902,357, and impacts 105 investigators and 25 K-9 officers. That pay raise is a 20% pay raise for the criminal investigators and a 5% increase for our K-9 officers. The next change is related to what you guys asked Director Keenan, and that's 19.2.2, and you'll see this change through each program, and that is an adjustment for the merit system assessment. It's a reduction in Department of Corrections budget of a total of $202,479, and that's related to those payments that we pay to the merit system to support all the personnel functions that they do across the state. The next major change comes down in our health program, and that's where the majority of the change was, and we spent a lot of time on that in the prior meeting related to the workload adjustments. As you look at it, 19.5.2 is the exact same amount related to the electronic health record system of $17,034,151, and just a reminder to the committee, that's a 3-year phase-in. In the 18 budget, you'll see an amount of $8.7 million, and then the third year, which you do not see, of course, this year would be $7.4 million, with a maintenance fee of $3.9 million after that for the electronic health record system. The next items, 19.5.3 through 19.5.7, are the split up. If you recall, we talked about workload adjustments related to pharmaceutical costs. That workload adjustment was $23.2 million that we discussed. 19.5, which discussed Hep C, 19.5.4, which discussed the general meds, 5.5, which is HIV, 5.6, which is psychotropics, and 5.7, which is chemotherapy. If you add those up, it is just over $19 million, $19,476,108. So it is a reduction of just over $3 million from what we discussed at the last meeting. Most of that comes into the Hep C area. If you recall, we talked about a potential of 320 patients of Hep C being treated. The budget that you see here for $10 million is related to what the current projections show of 220 patients being treated. We're about halfway through the year on that, and we're right at 100 patients, so that's looking to be a very good number. As we look at the rest, if you recall, we talked about the prescriptions, and we do about 103,000 prescriptions per month for the system, which is about 31,000 prescriptions more this year than we did last year, as we talked about at the last meeting. Those figures are seen throughout the increased caseload as well as an increase in the cost of drugs across each of these areas. So as we look at more detail on the generics, you're seeing an average cost of around $15 per prescription with about 31,000 additional prescriptions, as I just mentioned. HIV meds, you're looking at about 720 inmates being treated a month. We've seen about a 3.4% growth in that area, about 24 additional inmates per month being treated, and we've seen the cost of the drugs increased about 18% there. The average cost per month per inmate's been about $1,300 per month. When we look at our psychotropic medicines, we're treating about 7,422 inmates a month. That's about $33 per prescription. And then moving into chemotherapy, we have about 300 inmates that will be treated for chemotherapy for the year, which will range about $8,280 per inmate. And so that's the brunt of our area. We discussed a lot of that, as I said, at the last meeting, but it is a little bit different. As we move on through your tracking sheet, you'll see under state prisons, you'll see our next adjustment, and that is the funding of vehicles. You'll see that we are funding, and I apologize, let me get there. You'll see 19.8.4. You'll see the replacement of 4 medical transport buses for $360,000. We have about 41 buses in our fleet. We'll be replacing 4 of those that have over 250,000 miles, and these will be more designated for that medical transport and help us with our growing area of need in that area as far as our inmates that need medical services. The next item, 19.8.5, is a replacement of 87 vehicles for $2,165,000. We have 1,554 vehicles in our total fleet, of which we have 600 plus with over 130,000 miles, and we have 431 with over 175,000 miles. So these 87 vehicles will all be above the 175 mileage that's being replaced. And Mr. Chairman, I believe those are all the major changes from the last time we met. And obviously I'd be happy to answer any questions. We did discuss, you and I had a sidebar about the constitutional level of care, so I do have our General Counsel, Jennifer Ammons, with me, if you would like for her to address that issue. And then obviously Randy Sauls, that many of you met at the last meeting. He's our Director of Health Care and comes to us from the hospital down in Valdosta. He is here. And if I could, I need to make an apology. I should have started just as you did, recognizing my board members. So I apologize, gentlemen. It's wonderful to know you have support by a wonderful group of folks. I don't know if one of them left. We had 3 with us, but our chairman's here, Mr. Jerry Willis. Thank you, sir, for being here and supporting us. And the congressman that's already been recognized, he chairs our Finance and Budget Committee. And I think this is the first time since I've been working with corrections that we had some board members attend a meeting. So thank you guys for being here and supporting us. And thank you for that privilege.
We'll forgive you, but I'm not sure if they...
They may not. That's why I'm groveling. I'm begging.
I do want to, so the committee understands, I'm going to let y'all ask some questions. I want your Deputy Counsel, Ms. Jennifer Hammonds, to speak on this issue of the Hep C treatment. I'm going to get to you.
Okay.
But I'm going to let the committee members ask some other questions. They've got some more pointed questions. So let's take those first. I'll let my vice chair go ahead and do that.
Yeah, I just, before we hear the explanation of all this, would you reiterate those numbers again, the $10 million and how many you're treating? And
yes,
and how
sir.
that breaks down?
The $10 million for Hep C, as many of you know, we talked, and several of you were not at the last meeting. Hepatitis C has become a growing disease and a lot of focus on it. We've all seen the commercials on TV, and we know that pretty phenomenal event that for the first time ever, a viral infection has a cure. And that's one of the things that has driven more of a focus nationwide on hepatitis C. You guys have dealt with it from a Medicaid side to a Medicare side to a veteran side, just as we're talking about it here in the correction side. The average numbers across a population is about 17% that are diagnosed with Hep C. There is 4 different levels when you look at the treatment of an offender who has Hep C. Those that are in the first 2 levels live a normal life, and you treat those symptoms just as you would treat any symptom. However, once it gets to the cirrhosis of the liver, then you have to amp up that treatment. That treatment can be done by a multitude of drugs. The 2 main ones that we hear about is Harvoni. That about 85% of your populations can be treated by the Harvoni drug, and about 15% are treated by a drug called Sovaldi. Over the years, we've had a discussion in this committee about the cost of that drug. You guys will remember the astronomical cost we discussed a few years ago of $1,000 a pill and around $90,000 for a 12-week treatment. As that drug's been out, the cost has decreased. And in addition to that, one of the things that we had done years ago on our HIV treatment was we had, as you guys know, we partner with Augusta State University to provide our health care. Augusta State University several years ago set up a 340B clinic to where you can buy those drugs at a reduced cost, almost half. That treatment last session, that 340B plan had not been approved last session, something we discussed in the committees. And I'm proud to say through the hard work of Augusta State, we now have the Hep C at the reduced cost going through the 340B program. What that did was reduced, as we were testifying last year, one of the drugs, Sovaldi, is around 90,000 Sovaldi, and I may have them backwards, I apologize, and Randy can correct me if I am. The other one was around 80,000 if I remember right. With the with the 340B pricing, that dropped the one that we serve about 85% of our population down to the low 40,000 range for that 12-week treatment. And the Sovaldi's up around the $60,000 range. When you average that, it's around $45,000. So the $10 million is equated to treating 220 of our inmates at the average cost of $45,000 for that treatment. And that's where that $10 million comes from.
And just following up, the Vice Chair wanted to know for all of the ones that you listed,
Yes.
just run through those numbers on the numbers of treat. To be
Yes,
treated.
sir. The general meds, if you look at our general meds, our current budget, and I did not give this in the initial one, so this will be a couple of new numbers, but our budget as of today is $13.2 million. The additional monies that are being looked for is right at $5.9 million. Will take us up closer to that $19 million range for a total budget.
I think he asked about the number of patients, the number of inmates that are treated.
Okay. The general meds is a little harder to say on number of patients. What I gave you there was the overall number of prescriptions. The overall number of prescriptions there was 103,000 prescriptions, with an increase of about 31,000 prescriptions this current year. Per month, I apologize. The HIV, we treat 720 patients per month. That was a 3.4% increase per month by 24 inmates, basically. And the cost of the drug was up about 18%. Therefore, the cost per month per inmate was $1,300. The psychotropic drugs, we treat about 7,422 inmates per month. That cost per month would be $33 per inmate. And chemotherapy is an annual number, not a monthly number, and it's 300 inmates annually that we would treat at about $8,280 per inmate on average. As you know, a chemo, if it's throat cancer or if it's lung cancer, it differs on the length of treatment, could be continuous, and the intensity of it. So that's an average number when you look at those 300 and the cost per inmate.
Thanks, sir.
You're welcome.
Okay, great. All right. Let's see, Chairman Green.
Thank you, Mr. Chairman. Commissioner, you're asking for 87 vehicles. What is your total number of vehicles that you have in the department right now?
We have 1,554 vehicles. That includes the 41 buses I mentioned earlier. So that's the total vehicle count.
Mr. Chairman, do we have a count of how many vehicles are being asked by the departments?
In a lot of the requests, you'll see that the governor's OPB has rolled in the requested budgets that would have been capital budgets and bonding, but due to reaching a bonding cap set by the governor, essentially OPB is rolling those into the fiscal year budget as a one-time expense. But you're seeing a lot of vehicles that obviously rotate in and out. So we don't have the total numbers, but we can get those for each and every agency, and we can ask for them today also and have that for you.
Okay.
And I believe the chair, the commissioner said that they had, I think it was 431 vehicles. Over 28% of their fleet is exceeding 175,000 miles in over 10 years in age.
Yes, sir.
So we're not even, you're barely touching that part of the fleet.
Thank you. That's what we need to try to get a handle on, is the numbers there. Thank you, Commissioner. Appreciate it. And Commissioner, while we got all of you here, your folks are still doing a great job down at in the tornado area. We really appreciate the help that we received down there.
You're quite welcome, and very, very proud to be down there.
Thank
very
you.
proud of those guys.
I think, Commissioner, you originally asked for, twice that number of vehicles, so.
Yes, sir. It was somebody help me out on the exact number.
174?
I believe 4.9 million is what we asked for.
And that was about 174 vehicles?
Yes, sir.
Okay. All right, Chairman Powell.
Thank you, Commissioner. Thank you and your folk. I've got just a couple of questions. Or one particular question. You know, I look at in the supplemental, we're looking at an increase of probably over $20 million in drug pharmaceutical cost.
Yes, sir.
And we all know what the duties that we have to do with inmates, even though the citizens may not necessarily agree with that, since they can't seem to get, so many of them can't get proper coverage. But as I look at this escalating number in just pharmaceutical costs, are these costs associated, are these because of more inmates needing the medications, or are these directly tied to the rising costs that the pharmaceutical companies are?
It's both, sir. When you look at it, we have, when you look at our inmate population of 55 years and older, you're seeing a 9.3% increase in that population, where you're seeing a 10% decrease in those that are 18 to 25 years of age. So you're seeing an older, sicker population in the prison system, but you're also seeing an increase in the drug cost as well. So it's the combine of both of those. If you take generic numbers, and let me fess up on this initially, I don't know if it's a good apples to apples on what healthcare costs, but if you take our total healthcare budget of $207 million and you divide that by our 54,000 inmates and then did a monthly cost, you're looking at around $400 per month for healthcare for all inmates. Granted, let me say we have some in private prisons, and at a certain point they cover that cost. We have some in the counties, so that's why I say it's not an apples to apples, but it gives you a feel for what, when you take away that big number and look at the population of what a monthly cost would be per inmate. A couple of years ago, the Department of Audits did a great performance audit on health care, and they looked back to 2010. I mentioned this at the last meeting, and we were spending statewide at that time around 200 and, oh goodness, I'm blank, I believe it was $213 million, but I'm going to apologize to the committee. But it was more in 2010 than we're actually spending today. One of those is just because the agency, prior to me being there, did some great innovative things. We're partnering with Augusta University as far as having telemedicine, telepsych, ambulatory care units. But in that audit, getting to the point was they assessed the total cost per inmate to be right at $4,000 annually per inmate. So while it is a dramatic number in our budget, as I have mentioned, behind state prisons, private prisons, healthcare is our third largest expense in the agency. I believe that the partnership with Augusta and this department is doing a great job for the taxpayers of the state.
Thank you.
Further question, if I might.
Go ahead.
You know, I know y'all are good about thinking outside the box in the last few years, especially y'all have improved as far as the management of trying to squeeze everything and
Yes,
for
sir.
the most efficiency. Can you tell me that at any point, or if there's any discussions with other agencies or other state agencies per se of doing a coordinated contract to try to force these pharmaceutical companies that seem to be absolutely raping the American public?
Yes, sir.
Trying
And
to
Randy,
force the price of these drugs down.
And Randy, if you can jump in, there's several consortiums, Mr. Chairman, across the nation. One of them is a Minnesota consortium that we keep looking at, as well as others where several states get together. I think we can do a better job of getting a larger group. The one that Augusta State University purchases under is the Cardinal Consortium. So it's a small consortium that does exactly what you're asking for. Can we do better? I think if we could get these other consortiums all together and banner together, surely we could even reduce the cost more. But we do buy under the buying power of that consortium through both the buying power of that as well as Augusta State University to help with that. But obviously you can always do better. Yes, sir.
Thank you.
The other thing I would mention, and we'll obviously chase this more in the 18 budget when we discuss, is you'll see a recommendation that we're still ferreting through of actually bringing Department of Juvenile Justice. I think Commissioner Avery Niles is here. We'll be partnering together to bring Augusta University in to provide similar health care services across systems, and hopefully that will help with the purchasing power as well.
Good.
One
Good
further
questions.
question, if I might, Mr. Chairman.
All right, running a little on time.
Just one last. Is there anything legislatively that you department heads can think of that the General Assembly can do to foster the idea of a cooperative effort across multiple states to get these folks to the table? Because I know that if we're sitting here looking at our budget numbers,
Right.
I know that our colleagues in South Carolina, Alabama, Tennessee, Kentucky, they're running through the same problems. And healthcare dollars are what's driving the budget hole these days.
That's right.
Is there anything that you know that we can do legislatively to try to entertain or to open up the gates to this?
We will get with you on that. I can't stand here today and answer it, but we will definitely put our heads together and get with you on that issue.
Thank you.
Yes, sir.
Good questions and good cost-saving measures to be thinking about going forward. We have two more members I need to get questions from. Let me get that from Representative Williams, please.
Thank you, Mr. Chairman. I was kind of writing down some numbers, Mr. Commissioner.
Yes, sir.
Seems like your young people are costing us. Of course, there's a decrease with them, increasing with the older population. I'd like for you, when you come back, I won't ask you, but I want you to do the comparison between HIV/AIDS 10 years ago and what it's like today. When I was on state institutions and property 12, 14 years ago, we had a prison population of around 65, 67,000. We have a population now of around 54,000.
Yes, sir.
I want to see the differences in cost so that we can find out what prison reform and what recidivism is doing. I know it's a little early for recidivism, but particularly prison reform.
Yes, sir.
Because I keep seeing some escalation in dollars and some decrease in inmates. I just want to be able to put a handle on that.
Absolutely.
Thank you.
We'll address that a little bit in the joint appropriation, so we'll talk about recidivism there, but be happy to.
Thank you. And Representative Werkheiser.
Thank you, Chairman. Commissioner, just comment on a quick question. We've all seen horror stories of government waste, especially at the federal level in some of the state. I can promise you it's not happening at the Department of Corrections. Y'all do an incredible job. I mean, if we just look at the food part and then we're talking about the income, and to answer some of your question, working with other states, I understand we're going to be able to sell our eyeglasses to some of the other states and actually bring in some income. My question is, with the decreasing population, can you give us a broad picture of where we're going to be going with the private prisons? Do you see us backing down from that, or will they always be there with that segment of population they seem to do well with?
So I guess the first thing to address is the population numbers, and like I said, we'll look at those in the joint appropriation. But as you mentioned, we had a huge decrease in population when you talk about the 65,000 that we've talked about. A lot of that was in the jail backlog. We had about 5,000 to 7,000 in that jail backlog. So as criminal justice reform has come in, those numbers have reduced and have really stabilized. So we haven't seen, over the last 2 years, you haven't seen the number reduce. It's been around 52 to 54,000 for around 36 months now. And when you look at projections, we're projecting to stay pretty consistent with that when you look at commitments versus releases. We saw a height of about 24,000 commitments many years ago, and I'll have it in the joint appropriation meeting as well for you. But we're as low as 18,000 last year, and we're projecting to be a little bit higher than 18,000 this year, but pretty much on par. When you look at the releases, we've always been pretty constant at about 18,000 releases on an annual basis. So as far as future, as far as the projections go, is we believe we'll be pretty consistent at the current population. What does that mean for both our state facilities and our private facilities? That means as we look at our facilities and we continue to harden them and bring them up to date so that the contraband and the weapons and issues of that nature are truly, we have the safest environment we can have, we'll be investing in that old infrastructure to make sure that we can maintain a safe and secure environment for that 52 to 54,000 as we fluctuate. We have about 8,000 folks, as you're aware, in our private facilities. We have 4 private facilities in the state of Georgia. And based on those projections, I would not see them going anywhere. Also, at this point, wouldn't see them increasing. Right now, what we're seeing is a pretty plateau. What that means is we can, with our private partners and us, invest in those things that will impact recidivism. So just as you guys have done over the last few years, you've invested in both the state system, you've also invested in the private system as far as reentry efforts. And we've got some great success stories, especially in the welding, which you guys have funded, and the diesel mechanics. But welding is truly showing to be one of those entities that makes a difference in that inmate's life. And when they get out, they can find a job that is a high-wage job and move those numbers down. You'll see them incrementally. You'll see that our recidivism rate is down, I believe, at 24.6%, which is creeping down year after year, and those hard efforts are working. But I believe, as I have talked to both of our private partners, one company is CoreCivic and the other one is Geo Group. They are committed, just as we are, at trying to make sure that number continues to reduce. However, with the rising population in this state, as we continue to be a great state to live in, our population numbers continue to increase. That 52, 54,000 will stay fairly constant based on our projections.
Thank you.
Thank you. Let's one question, and without an answer, I'll just ask you to send it to us. If you would, I'd like to see historically, what were those the release numbers? So over the last 10 years, what have been your release numbers?
Absolutely.
And then can you characterize the releases on whether it's serve the sentence completely, there's parole, probation has been installed, something along those lines can give us the numbers, break the numbers down that way?
We'll see how we can break that down and get with you, but I would think we could.
All right, thank you. Now, back to the question that I wanted to make sure we spent some time on, but with about 4 or 5 minutes, Jennifer, if you could.
Okay.
What I'd like to do is I'd like to provide a little further education because it's a hard pill to swallow, no pun intended, for I think us and the public to understand what we're doing in terms of treating inmates that have come in with Hep C, and what our constitutional and legal obligations are in terms of providing care while they're inmates with the state. So if you could speak to that and then also just speak to that. My understanding from the commissioner is that we are taking the most fiscally responsible steps to provide care within the confines of known decisions and federal law. So, but if you'll elaborate on that, Jennifer, I'd appreciate it.
Yes, sir, we're happy to, Mr. Chairman. As you have said, we have a constitutional obligation to meet the health care needs of our offenders. That's been recognized for decades by the United States Supreme Court and by our appellate courts that are here in Georgia. That extends to all of their medical needs, including those that suffer from hepatitis C. If we are not meeting their medical needs, then that can result in liability for the department and for the state as a violation of the Eighth Amendment dealing with cruel and unusual punishment, which is probably not the first thing that you think of when you think about whether or not medical care needs to be provided to an offender. But that's the basis for the cause of action that is typically filed when an offender feels that their medical needs are not being met. And the standard that we are held to is whether or not we are showing deliberate indifference to their medical needs. Now, hepatitis C has been recognized by the appellate courts as a medical need that does need to be addressed in the correctional community. And so it's incumbent upon us and our sister agencies across the country and the Federal Bureau of Prisons to identify the best way to deal with that problem given the fiscal limitations that apply because of the costs as we've already discussed it. And so the approach that we've taken, which is very much like our sister states and the Federal Bureau of Prisons, is, as the commissioner has articulated, a staged approach where we base the availability of these drugs upon the severity of each offender's illness. And what the case law has indicated is that so long as we're providing care for the symptoms as they arise and doing what we need to do to make sure that the cases that escalate to those higher degrees of illness, where you're getting close to cirrhosis of the liver or cancer or something like that, that's where we are legally obliged to be providing care to those offenders with these very expensive drugs. The courts have not come out and said, prison systems, you must do this, but the courts have upheld approaches like this, and that's why we feel like this is the most fiscally prudent approach to take. If we were not to provide this care to these offenders, we expose ourselves to a great deal of fiscal liability, not only in the context of a cause of action for a constitutional violation, but if the offender was to die as a result of non-treatment by the department, there's also the potential liability for a wrongful death suit. We also have seen agencies, including the Department of Corrections in other contexts, be investigated by the Department of Justice and be subject to federal lawsuits where the resolution of those cases involves the appointment of monitors that are extremely expensive, and we would bear the cost of all of that. So while it is somewhat unpalatable to think about the price tag of the cost of these drugs, the cost of not giving the drugs to the offenders when they truly need them is exponentially higher.
Could you also speak to, we are not screening inmates as they come in. Could you speak to that and what those costs would be for us and how that might affect our appropriations?
I would need to probably defer to the Assistant Commissioner on the cost of the actual individual testing. You are correct, we are not testing every offender. Testing is based upon medical need. If an offender is symptomatic, then the medical folks through Augusta University would arrange for that person to be tested, and if necessary, depending on how the level of disease is classified, if they do turn out to have hepatitis C, that's where those decisions are made. But we are not testing every offender. We do have a partnership with Emory University. They have received a grant to test offenders on a voluntary basis at one facility, and we're actually looking at expanding that program. What they're looking at doing is partnering with it dovetails beautifully with our reentry efforts, because they're putting those offenders who do agree to be tested and do turn out to have the disease that we haven't already identified, they're putting them in touch with community resources so that they can get the treatment that they need upon release.
These are offenders that are being released as they come into the community, then they can get treatment.
Okay, setting aside the Emory, study, what you're describing is essentially the sweet spot between fiscal prudence and providing adequate medical attention as it arises.
That's correct, Mr. Chairman. The place that we don't want to get to is a court ordering us to test every offender, and even more disturbing, treat every offender, no matter what the level of disease is. That would be, I just can't even quantify what the cost of that would be.
And these are again constitutional legal obligations that the state bears, despite whatever the activities of the inmate were before they came into becoming an inmate.
That's correct.
Okay. Questions, Ms. Hammonds? Any questions? I thought this would be helpful to get a perspective on where the commission, and this goes back to Chairman Powell's point about how innovative and fiscally responsible the department has come. Chairman Powell served as chairman of this committee for, I don't know, a couple hundred years, and I think since Oglethorpe came over with the first set of prisoners, and so it's as a result, he has extensive knowledge, and he has seen I think the fiscal restraint that this department has employed, and I bring that up because I think it's important to have historical context. I find that extremely valuable as a younger member of this august body to have some historical context, and I think that's important for our new members to have that. Okay, without any other questions, then I really appreciate the presentation, appreciate the team that you brought here today, Commissioner, and we'll look forward to getting that data from you a little later on. Okay, we'll keep on the schedule as best we can here. We're running over a little bit. Next up is the Department of Juvenile Justice. We have Commissioner Avery Niles. We are pleased to have you here, sir. Let me. Yes, sir. And thank you, Commissioner Niles. Pleasure to see you as always.
Yes, sir. Thank you for having us. And we will start on page 31 of your tracking documents. And you'll see in the governor's amended fiscal year budget of $2.6 million. Section 31, I'm sorry, Section 31. Section 31. And Mr. Chair, we'll start off with the 20% pay increase for law enforcement. That's going to affect some 141 certified law enforcement officers. Ranges from school resource officers all the way down to our HITs, which is our high-intensity units that are out daily checking on our more challengeable youth that's in the community. 31.2.3 on your tracking sheets, vehicle replacements. We're looking at 40 vehicles that we're going to replace this year. The question was asked earlier from how many total vehicles do we have in our fleet. Mr. Chair, we have some 478 vehicles. That includes our transport vans. Of course, we don't do the number of transports in volume like the Department of Corrections. So we utilize vans and vehicles. Section 31.4.3 is the Terrell County adjustment in the salary adjustments for the JCO's juvenile correction officers. Of course, this fiscal year, the department received some 10 months of operational funds. This request and adjustment for the JCO salary went into effect in July. The original budget request included the old benchmark salary, and this is just uprighting and making sure that this fund's balance is matched up with where it should be. And then some $539,000 will go to the Augusta University. That will be found on the 31.4.2, Mr. Chair, on your tracking sheets. This is for the nursing staff transferred effective January 1 of this year to the Augusta University. And you heard earlier from DLC Commissioner about how we are looking at merging those resources to better equip the agency as well as the state on how we deal with that care for our youthful offenders that's in our care. Mr. Chair, that's all the items that I have that we have not or have previously discussed.
Thank you, Commissioner. We appreciate you took a number of the members of this committee on a tour of the DeKalb facility, and our appreciation to you and to the facility director.
Yes, sir.
She did a great job giving us a tour and a good feel of the hardening that needs to occur and has been occurring within the facilities. And we have been appropriating money for the purposes of hardening, both in the Department of Corrections but also in DJJ. It was very good for committee members to go and see what is being undertaken in that respect. Also to see the programming and seeing volunteers, people that are coming out of the community to help, to be mentors, to participate in the education, the physical education of the kids in there, trying to help them get a second chance. So appreciate that very much. As a question, going back to the JCOs, the juvenile correction officers at Terrell, there's just a concern here in the HB 751. Terrell is opened in October, if I'm correct, of this past year. And then employment was done, I think, in September thereabout for those JCOs. Now, I know you've added more JCOs because we were closing one facility, and Terrell's a larger facility than the one that was being closed, so you had to add more to it. And so there was, in looking at this budget request, I had to ask, why did we miss it when we were doing the 751 House bill last budget year. And so we're adding this additional salary that I feel like we should have caught, because we knew at that time we were getting a percentage increase. I believe it was 6% or more at that time when you add the additional statewide. So that's the question that came to my mind when I reviewed this track sheet. And I'd ask if you could address that, please.
Yes, sir, and thanks for the question. Of course, we opened the facility the beginning of last month. Anytime we have a new facility that's open, it's just not like you open it and move in it the next day. We have the Albany facility in which we were closing, and we transferred those staff members. And then we brought on new staff members, and through our academy, running those students, those cadets through the academy, and then once we got those on board, had to train for those additional 2 months of training. How did we miss it? I think that we just, in this situation, when we look at it, those monies that we budgeted for when the budget was submitted, it wasn't approved as of yet. And this is just truing up the numbers since it's a full-blown budget. But we do thank you for bringing that up. But we do have situations where we have to have training for those staff members there before we actually move into the facility.
Okay. Our questions from members of the committee. Chairman Green.
Thank you, Mr. Chairman. Commissioner, I just want to say that we're delighted that that facility is now open, and I want to invite this committee to come down and see what we can do with old buildings and turn it into something very useful that the state has. And, Mr. Chairman, it is absolutely stunning what they have done down there, and we're so proud that it's open. And if you want to blame somebody, blame me about the money. And
well,
I heard that.
If you'll serve up some good blueberry pancakes, I might be able to make that trip.
We will do more than that, won't we, Commissioner?
Great.
Yes, sir.
Any other questions, comments from members of the committee? Commissioner Niles, thank you very much.
Thank you, sir.
Thank you for being here today. Appreciate
Yes,
it, both. All right. Next on the agenda, Public Defenders Council, Executive Director Brian Tyson and Terry Radford, Budget Director. Go ahead, Mr. Tyson. Thank you so much.
Thank you, Mr. Chairman. I appreciate it. I have Ms. Rayford, our Budget Director, along with our Deputy Director, Jiminique Rogers, and our External Affairs Director, Cheryl Karunas here. As y'all will recall from our earlier meeting, we as public defenders serve as the red team of the judicial system. We're the ones who test the assumptions of the state and check and see if the assumptions are correct, and if they are, we can all have confidence in the outcomes of the system. But by protecting the rights of each individual Georgian, regardless of their economic status, who comes in and interacts with the criminal justice system, we ultimately protect the rights of all Georgians to ensure that the government is not overreaching and extending into someone's constitutional rights inappropriately. For our amended budget request this year, we obviously, to begin with the first items there in section number 37, we are an agency that is primarily personnel, and so our capital needs that we have as far as infrastructure goes are primarily computers and vehicles. Our agency had an initial purchase of computers at the beginning and vehicles, and we've had an aging of those things with a lack of replacement of them over time due to lack of funds. And so as a part of our amended request here, we have $327,000 for computer equipment and $1 million that would relate to vehicles. We obviously are incredibly grateful for the vehicles we were able to purchase through last year's bond funds and have made good use of those, trying to put those in the circuits with the highest mileage costs to realize some cost savings. If we were able to get these vehicles as well, we would obviously continue that process and place those to reduce our mileage expenses and hopefully save the state money along the way. When we move down to the Public Defenders Program, you will see the large number, the $3 million request there. As I explained to you in the earlier hearing we had, our conflict spending has reached a point of stability. We do not have conflict spending going up each year. We've had stability for the last 3 years on that number. What we have here really is the $3 million enables us to get our budget base where it needs to be. For most of the agency's history, we have operated the agency on emergency funds, administrative fee revenues collected from the counties, and state funds. We're in the process of moving to where all of the agency's operations will be funded out of state funds. Last year, we had $3 million in the amended, and we did not put that in the general budget because we wanted to get one more data point to make sure we had the right number to roll off the emergency funds. We've concluded at the end of the 16 year that was correct, the $3 million. So you'll see the $3 million here for us to finally move off of emergency funds onto state funds in the amended budget, and you'll see that number come up again in the big budget. And then finally, our last item there relates to the accountability courts in South Georgia and Tifton, and just trying to recognize the accountability court supplements there. I think all of us were working from an assumption of where the Council of Accountability Court Judges would come out with their certified list, but obviously we want to make sure that we've accounted for any circuit public defender supplements that are required by statute for certified accountability courts.
So, Mr. Director, thank you so much for that. Let me jump down to 37.2.2, and this is the conflict cases. Is that really an accurate description of what's happening, and is this once this is paid out? So it's multiple questions. One, is that the best description, or really we're really reasserting your administrative funds that you've already paid out? You've used administrative revenues to pay out on conflict cases, and you're just being essentially reimbursed for that?
No, exactly. I'll start with the description that is probably not the ideal description for what these funds encompass. We've basically been running the agency on three sources of funding. State funds, well, not including the county funds, but state funds for operations, governor's emergency funds, and then our administrative fee revenue from the counties. The $3 million represents what's necessary now that we've exhausted the governor's emergency funds that have been rolling over year to fund agency operations. The $3 million represents the conversion basically from emergency funds to state funds to make sure that our budget base is accurate for that.
Will we see that $3 million request in 18 then?
Yes, sir, you will. And then once that becomes part of that is basically part of our agency budget, that will get us off of governor's emergency funds completely to fund our agency operations.
So then we will not see it in the FY18 amended, is that?
That is correct, Mr. Chairman. And we would have not seen it in the FY17 amended if we had put it in the 17 big budget last year, but we wanted to make sure that there wasn't a different number when we got the final end of the year settled out, since we were converting from those emergency funds to state funds.
Okay, and then there's other questions from members of the committee. Just real quick on the items 37.1.2 and 37.1.3. My recollection, Mr. Executive Director, is that these are not high priorities for the agency. Could you address that? What are your priorities, and what would you rather spend the total of about $1.3 million on if we were to make a change, and if you wanted us to make a change?
Yes, Mr. Chairman, thank you. And obviously, as an executive branch agency, we're asking for the governor's recommendations, but I can clarify for you the question of priority. For us as an agency, our primary goal right now is to move away from these alternative revenue sources to fund agency operations. And although the $3 million will take care of our state fund conversion from emergency funds, we still are running agency operations on our administrative fee revenues from the counties. Right now, our last 2 months of our fiscal year is paid for out of county funds we collect through the administrative fee, and along with our training expenses, our travel expenses, and our expert expenses. So our primary agency priority right now is to move as much as we can away from administrative fee revenue to fund the agency and move that over to state funds, because that's our statutory responsibility to provide those services. So for us, that would be primarily our training operation. If we could move that out of our administrative fee, would be a huge help for us. But I also want to be clear that from an agency need perspective, we obviously have the infrastructure needs as well. But our training revenue, our expert fee revenue, those things that we're currently paying for out of our administrative fee would be extremely helpful to get those into state funds. Obviously, for us as a personnel-heavy agency, our capital needs are generally limited to the issues of computer equipment and vehicles.
Okay. Chairman Willard.
Okay, thank you, Mr. Chairman. Let me go back to $3 million again. This is attorneys who you're employing as independent attorneys outside your agency.
Yes, Mr. Chairman, that's part of what this will cover.
They're being employed for conflict cases primarily. Is there another need other than conflict cases?
No, Mr. Chairman, we have the private attorneys that we have under contract. We have about 200 attorneys total under contract with our agency to provide services for us in conflict cases across the state. We don't have any other services that private lawyers provide to us.
Tell the committee the standard that has been applied to your agency regarding the need of having an attorney as a conflict attorney come from outside the specific office where a case is pending. Would you explain that to us, please?
Certainly, Mr. Chairman. When the State Bar issued a formal advisory opinion, I believe it was in 2013, related to the operations of our agency, what the State Bar concluded in looking at the ethical obligations of the lawyers was that each circuit public defender office constituted a law firm. And because of that, every conflict that you had coming into there was imputed to every other member of the law firm. So the best example I can give is if you have two people who rob a convenience store together, allegedly, and they both need to claim that the other one was the primary involved party there, they may need to point the finger at each other, they can't have the same lawyer represent them. And previously, there had been an interpretation of the ethical rules that we could have two different lawyers in the same office represent those individuals. Under the State Bar's conflict rules, as they announced them, the rules that apply to law firms apply in full to us as an agency. And so we can't have any other lawyer in the same firm represent that other co-defendant. It has to go to somebody outside of the office.
And going to outside the office, are you able to go to the adjoining and contiguous public defender's office and obtain assistance in that manner?
We've tried that, Mr. Chairman, and what we found was the geographic coverage limitations were so difficult. The judges we weren't able to have, when the judges expect us to be in one circuit court office in their chambers, we couldn't simultaneously be in a different circuit. We have tried a pilot program where we located a lawyer in an adjoining circuit to serve the conflict needs of the circuit that was next to it, and that's had some success for us, and we've continued to look for ways that are kind of creatively finding solutions that protect our ethical obligations but also allow us to provide effective and efficient and relatively low-cost conflict services.
May I ask one further question, Mr. Chairman? Have you done a study as to try and determine whether it would be more fiscally responsible to have conflict firms set up by your office as opposed to the employment of outside attorneys for that purpose?
Yes, Mr. Chairman, we have, and we actually operate 6 regional conflict offices in our areas of highest volume. What we discovered was that in the areas that don't have as high a volume as Atlanta or some of the other metro areas around, hiring a full-time staff person to handle what would be maybe a 10 to 15% number of cases that a public defender would handle was not an efficient use of state funds, and actually we realized a lot of cost savings by using contractors as opposed to using staff in those situations.
Okay, so you've looked at that, and the remedy you see is having $3 million fund for that purpose. It may vary a little less than that, a little more than that, depending on what your conflict cases are. You don't really know today as you look at the future what your true needs are.
Yes, Mr. Chairman, and the design of the administrative fee revenue from the counties, the Office of Planning and Budget, I believe in 2015, announced that the administrative fee revenue that we're currently using for operations and training and experts was supposed to be that cushion for our conflict funding, because we recognize it is uncertain year over year. You may have a spike in gang activity in a particular circuit, and that requires obviously a lot of outside counsel because people are acting together, so we have to hire more lawyers. That may be a one-time event. We don't want to appropriate state funds long-term to reflect that. So the purpose of us getting off of administrative fee revenue to fund our operations really is to give us a cushion. The $3 million that you see here is not so much for conflict cases directly as it is for the agency operations, of which conflict cases are a part, that were previously funded by governor's emergency funds when we first hit that bump of not knowing how many conflict cases we would have.
One last question, may I, Mr. Chairman? I'm going to touch on something you may wish not to respond, and I'll accept that. Does the system that we have set up currently under the law, where you have the various circuit public defenders and their offices being autonomous, cause problem for you as a director giving oversight and full management to the system throughout the state?
Not in the current setup, Mr. Chairman, and the reason why is this. Several years ago, we made some changes to the structure of the agency that provided more direct oversight for the director over circuit public defenders. So I now have the authority to remove a circuit public defender for cause, as I have done over this past year, someone who was there were some problems with their office. We're at the point as far as an agency structuring question goes now where I believe I have a sufficient amount of power as the executive director to effectively oversee the offices while not impinging on the ethical obligations that we have to keep those as separate firms.
Thank you, Mr. Director.
Thank you.
Follow up on that one question. What is the method of accountability that is used to determine whether or not you're getting the high value necessary or the quality of representation that this state thinks is appropriate for the public defender's office from those outside contract attorneys? What metrics are you using that you have in place to monitor the case, the duration, the length, the expediency in which justice is being delivered? What are those metrics that you're using, if any?
Yes, Mr. Chairman. So one of the real challenges in the defense context is trying to figure out what quality representation looks like. We can't necessarily look just at outcomes because we don't necessarily know from an outcome how good the lawyer was in a particular context. Even the time to resolution is not necessarily a good marker for us because there may be an interest of a client to slow walk a case and to have a case move a little bit slower versus some other clients who need cases to move expeditiously. So because there's so much variability in practice, not only among the different circuits, but also in each individual case, right now for our employed staff lawyers, we're using a system of core competencies that they must meet, some core competencies they must have as far as communication with the client, communication with the court, being able to advocate, and having their supervisor monitor that. For our contractors, that's a much more difficult question because they are more dispersed, they're operating on their own. As an initial matter, they're all lawyers. They all have their own bar license that would be in peril if they committed malpractice in a case. So that's one level of protection that we have. Beyond that, we require reports from the contractors on a regular basis that we enter into our central database. Those are infrequent right now, just kind of critical stages of the case, so we know when the beginning and the end of the case is, and a couple other critical markers. Beyond that, we are still looking for the right way to monitor our conflict contractors. Right now, we obviously respond. If there's any complaint, we immediately go and investigate that. We talk with the client, look at the case file, talk with the attorney, try to address and figure out what's happened in that case if the lawyer's decisions are reasonable. But right now, we don't have as coherent a system as I would like. We're trying to move toward that and looking for those markers, but haven't quite identified all those yet.
Well, I would urge you to do so post haste.
Yes, Mr. Chairman.
And also, I'd also like to know who is supervising the work. And it's a little difficult because you have the conflict, but after the fact, are the individual regional offices, are they looking back over these cases and double checking to see that the state is receiving quality representation for the value? I mean, for the fees paid out.
Mr. Chairman, we are not going back to each individual case file because there would be privileged information in those case files that we would end up kind of creating into one giant law firm if we were to review every case at that level. I will tell you that our circuit public defender offices, our staff offices, do report to us what they see in court. And if they see a lawyer who is failing to do his or her job, who is one of our conflict contractors, they report that to us. But there's not a kind of post-case review. Last year we closed about 100,000 cases in felonies and juvenile court. So the scale of that is large, but the individualized nature of representation makes it a challenge to determine whether each decision made was appropriate in that case.
And is there a frequency in which you're rotating attorneys or putting out for requests for those that may be interested in serving as conflict attorneys?
Yes, Mr. Chairman, there's a kind of a logical flow to that. There are people who are generally dropping off, and then we have opportunities to move people on. We also have some conflict attorneys that we hear who are not doing their job well, and when we investigate that, we determine that, and we remove them from contracting with us and replace them. We try to put out word to the Georgia Association of Criminal Defense Lawyers or others who practice in this area, asking for assistance, especially when we have gang cases or other issues where a RICO indictment, for example, comes down and there's 60 or 70 co-defendants charged. That's obviously an immense expense to the state that results from that because we have to get outside counsel for each one of those individuals.
Very good. Chairman Willard.
Thank you. I have one question come to mind from what you were asking, and that is within the public defender's counsel and the attorneys, on the cases on appeal, is the defense raised ever, or the fact of the failure of the proper representation of a client as a defense to reason for an appeal and reversal?
Yes, Mr. Chairman. As far as the appellate process goes in the criminal side, ineffective assistance of counsel is regularly a way that you get at error that was not preserved at the trial level. And so that's frequently raised. We have a separate appellate law firm that was created as a result of a settlement of a case several years ago that can raise that if necessary against one of our own offices.
Well, it kind of concerns me. I guess I might follow up. Does your office investigate as to the validity and the real underlying purpose of that as being whether it's valid, or is it just one of these things to try and say, throw everything in the basket together?
One of the challenges we face as criminal defense lawyers in Georgia is the lack of an ability to file what are called Anders briefs. And there are opportunities in other states that allow the criminal defense lawyer on appeal to review the record and say, listen, I don't really see any error here. We can look at sufficiency and then move on. In Georgia, we don't have that ability to file that kind of brief. So an appellate lawyer is duty bound to raise whatever he or she can raise that's appropriate. And a lot of times ineffective assistance may be the only thing that you can raise in a particular context.
Grumble.
Absolutely, and just to be clear, if there is an effectiveness that is found against one of our offices, we certainly are very aware of that and take action immediately if that is found by an appellate court.
Well, that for the contract attorneys as well.
Yes, sir.
Okay. All right. Other questions from members of the committee? Thank you, Mr. Executive Director.
Thank you, Mr. Chairman.
Ms. Rafer, thank you for being here as well. Appreciate it.
Thank you.
All right. Would anyone on the committee, does anyone need a break on the committee?
Yeah, until 8:30 in the morning.
Yes. The answer was a yes with a wave goodbye from the judge. Does anyone else? They need a. It's almost his bedtime. All right.
Now that was cruel.
That was
cruel.
He'll get me later. Trust me. Anyone else? Seriously, if you need a break, we'll take it now. If not, we'll keep rolling. All right, let's roll. All right, motion and second. We're going to keep going. All right, let's have the Peace Officer Standard Training Council. We have Ken Vance. Glad to see you again. Appreciate you coming.
We're in the 39.8 part. We only have 3 items. Most of them, if you've heard from various people already today, the additional funds to retain our criminal investigators, $103,000. Of course, then you have the bookkeeping thing there by merit system assignments to align the budget. That's a bookkeeping deal. And 39.8.3 is one-time funds to purchase 2 vehicles for 2 criminal investigators. We only have 12 vehicles. So what is being done here, sir, is that I think OPB and the governor's office is doing a good job in trying to plan ahead. We have a chance to get 2 additional investigators with the FY18 budget, and what they're doing now is buying vehicles ahead of that, and personally, I think that's a very good idea.
Are these will these be one vehicle per investigator? Is that
Correct.
right? And you have how many investigators?
Right now, today, sir, we have 9 investigators for the state of Georgia.
And do you have vacancies?
No, sir.
Okay. And so these will be just 2 additional vehicles. We're not replacing any aging vehicles.
No, sir.
Okay.
No, sir.
All right. Questions from members of the committee? Seeing none.
I would like to recognize my new representative from my hometown, Representative Rick Williams. He doesn't, he doesn't have an office yet up here, so I can't find him, so I'm glad he came to this meeting so I could see him.
Well, let me speak on Rick's behalf here. He is, I think he's attended all of our meetings this year. So he's, and we did have some preliminary meetings before we started, and so Rick's been sitting in I guess he's been looking for you actually to show up, and this is the first time that we've seen you. So
This conversation lasted longer than the presentation.
that's right. Thank you, Mr. Vance. I'm sorry, one question. We do have one question. Mr. Grafley, thank you.
Thank you, Mr. Chairman. Thank you, Director Vance. I believe it was last year you had worked with us, and I want to thank you for that, on an initiative that we didn't need. We ended up not needing legislation, but we were going to give a break to retired officers who wanted to keep their training, but yet we weren't going to charge them the $25 fee for every firearm they wanted to. Has that been working?
It has been wonderful, sir. What we did, if you qualify with more than one weapon and you're a retiree, rather than charging you one price for one price for another, we have a one-time fee. You qualify with as many as you want to, and that we send you the card noting those guns that you qualified on. I appreciate you doing that, and I think we worked out something that's actually good for all of us.
Well, I want to thank you for your help on that. It couldn't have been done without you. Thank you, Mr. Chairman.
So let me make sure I got that straight. So before we were charging for every single certification with each different firearm.
Yes, sir.
Okay,
It was
so
a $25 charge every firearm.
So, Mr. Rabb, you've joined this committee and you've cost us money. Is that what you're telling us? All right. Thank you very much, Mr. Vance. I appreciate it.
But I saved the retired officers' money.
we do appreciate that.
Yes, sir.
I'm joking. All right. Thank you, Mr. Vance. We appreciate that. We'll have the next person coming up.
Thank you, Ken.
And that is going to be with Georgia Public Safety Training Center. We have Chris Wiggins, Director. Thank you. Mr. Director, thank you for being here, and appreciate your time today. And thank you also for the invitation to members of the committee to join there for the graduation, recent graduation. And I see your enrollment is ticking upward, and that's a positive thing, I think.
That is. Thank you, sir. Thank you, Mr. Chairman, board members. We're on page 13 of the track sheet, section 39.9. The first item is 39.9.1, which is the 20% pay increase in the governor's initiative for a total of $526,073. It's 39.9.1 will be the first. Okay.
Go ahead.
Second item is 39.9.2. That is the merit system increase, $496. The third item is 39.9.3, which is the request for one-time purchase of 10 vehicles to be used in the newly transferred program of the Crisis Intervention Program that's coming from the GBI to the training center. And that was phase 2 of the governor's initiative. There was 2 phases. The first phase covered the 20% pay incentive. The second phase is a great deal of additional training.
Just explain to the members of the public and the members of the committee the Crisis Intervention Training Program.
What it is, it deals with a lot that's going on throughout the nation in de-escalation, dealing with the mental health community that's growing, especially in the state of Georgia. So what we do on the first 3 days of the training is you talk with the officer, train the officer on de-escalation skills. The last 2 days you actually take them to mental health facilities and bring in clinicians in those fields to talk to the officers on the last 2 days. So you're using the behavioral health model on the last 2 and the law enforcement model on the first 3 days. And it's combined into one program and hopefully teaches them how to de-escalate a situation and deal with some of the mental patients that we're dealing with currently.
And isn't it true that our training center and under your director and the previous director, that we have as a nation, the state of Georgia has been training officers on de-escalation and conflict resolution and community policing well in advance of some of the federal initiatives that we've seen.
That is correct. And we had a Board of Public Safety meeting this morning, and I made a statement that we just released a new online program that deals with use of force training and de-escalation that every officer in the state will have to participate in. We saw an enrollment of 500 students in less than 10 days in that program. And I can tell you I can take that program anywhere in the nation and it will surpass any training that's currently going on, federal or state or local.
We appreciate that. I think that training is important and essential, and it does. And what we see is we see, I think, if you look comparatively, and not only by the grace of God, but good training, I think our state has avoided some of the mistakes that other law enforcement agencies may have made. And so we really appreciate the training and the work that you're doing in that regard. I see that you have here provided one-time vehicle purchase for the 10 vehicles. Could you explain why you need the 10 vehicles?
I will. Currently, we have 60 tagged vehicles, and we have 210 untagged vehicles. Those of you that have not been to the center, the majority of our fleet is untagged that we use on the track.
Meaning not road?
Not road worthy. They are driving worthy, but we do not put them on the road, so they're used specifically for training purposes. We received our newest fleet this morning with a donation. Most were 2006 and 7 vehicles with in excess of 100,000 miles on each. If that kind of dates our training pool of cars. But these 10 cars that we're requesting, they will be used. You will see in the 18 budget, not to get ahead of myself, but we're requesting some positions for the CIT program as well. These cars will be used for those instructors and officers that go throughout the state. We will break the state up into different sections, and they will use these cars because this is a community-based program. So we're going to have to these instructors will have to rely on the mental health facilities and clinicians in that area, so they will be doing a great deal of traveling.
So this is going to be basically within the community training law enforcement that sign up for this program. You'll go to those PDs, those sheriff's offices, you'll go to those areas, and these particular agents or trainers will then go and use these vehicles to go to those areas to make that training within the community. Is that right?
That is correct.
Okay. Any questions from the members of the committee? Thank you, Director. We appreciate your time today.
Thank you.
Next on our agenda is the State Board of Pardons and Paroles. We have Executive Director Chris Barnett. Thank you for being here today. Chris, we appreciate you coming.
Good afternoon, Chairman, Committee. Today, I really have only 2 line items. I'll start in Section 35. I believe it's page 11 on your track sheets. First line item is 35.2.1, and that is the 20% pay raise for law enforcement officers. We currently have 181 employees, including the 5 parole board members. Of those 181 people, we have 48 post-certified law enforcement officers. This pay raise will give 35 of those individuals that 20% pay raise. Those 35 are line officers that are actually doing the work every day. Our second line item is 35.2.2. This is to eliminate the federal funds associated with the federal task force to reflect the transfer of personnel from the State Board of Pardons and Paroles over to the Department of Community Supervision. So it's pretty much a cleanup, if you will, from the transfer that occurred last year from the field supervision moving from the parole board over to the Department of Community Supervision. And that's really our only 2 line items for amended FY17.
Thank you, Mr. Executive Director. I believe you and I have talked a little bit offline about looking at ways to enable the parole board, the members of the parole board, to incur greater efficiencies or to allocate more time, if you will, to the review of cases by creating some level of administrative review so that the cases that need more of a hearing and more vetting can get that review, and those that are are really just have not reached a certain level of qualification for a parole or pardon, or probation, that those can be administratively examined. Have you had a chance to look into that?
We have. We're still in the analysis phase of it and trying to work with the board to kind of see what those parameters on that automatic set-off would be. I will say, and if the committee pleases the committee, this FY17 amended budget is our 3rd straight budget that we submitted a flat budget. I took over the agency in April of 2015, and it's been my goal as we remission the agency to kind of look internally, see what we have available, make sure that we're using and gaining the most efficiencies from both our people, our processes, and our IT. One of those is kind of like Chairman Welch and I just spoke about, is looking at those cases that come back before the board. The board has made a decision sometime in the past that cases come up for what is called a final review before they are actually paroled out, and there are deficiencies with that case. They have disciplinary reports, failed to complete some programming while they're incarcerated. Currently, all of those cases are going back before the board for reconsideration. What Chairman Welch and I have been discussing is there a way to say, if certain criteria are met with that, can we do an automatic set-off for 6 months, 12 months, or 2 years, and allow that board, the board, more time to focus on those other cases? Right. We are in that process, and we continue to work that way.
And then maybe some legislative enactment that needs to help to support that, but we'll talk about that more as you do your assessment. I'd like to hear more about that in the future. And also, I wanted to ask, you see Representative Petrie here. Have you had a chance to look at his House Bill 34?
Yes, sir.
I just would encourage you to look at that and try to work within those confines. There's an opportunity also with this legislation that's being proposed to maybe work in some of those efficiencies that we're talking about. So we have a vehicle here. We have an opportunity with this legislation to do that. So I encourage you to work with him and work with me on trying to, your staff working with us, to try to incur those efficiencies, and also make sure that the boards are examining the cases that really need to be vetted, that may be really legitimate issues for release, but also making sure that it's not just a default switch on the release. And so, if you and your staff could work with Representative Petrie, I'd appreciate that.
We absolutely will. Since coming on, one of my primary priorities, if you will, moving forward was to ensure that we are engaging our community stakeholders, we're engaging our criminal justice partners, we're educating them on the parole process, we're encouraging their active participation in that process, and if we accomplish those three things, we think we can enhance the parole process for the entire state and provide a better product. I think Representative Petrie would back me up on this. We've sat down across the table many times, not only with his, but his delegation and those that he represents, and we've done some great progress thus far. And we continue to look to further dialogue, not only with him, but with the rest of the committee, and moving it forward for the state of Georgia.
Very good. Now the hard questions come. Chairman Willard.
I was just curious, Director, on the task force, federal task force, what was that about and purpose of it?
Okay, when we controlled field supervision, or we had field supervision under our direct supervision, we had officers that were full-time assigned to the U.S. Marshals, as well as the DEA and several other task forces around the state. And as they would make cases and seize property, that property would come up for asset forfeiture funds once that case had gone through its cycle. Since we no longer have those personnel and we're no longer represented on those specialty task force, we felt it was appropriate to transfer those funds and the ability to collect those funds to the Department of Community Supervision. In fact, July 1st of 2016, we signed an agreement with the Department of Community Supervision to transfer everything that was currently in the bank account to them, as well as any future asset forfeitures that would come through that account to them as well.
So if I understand, these are your employees that were assigned to a federal task force, and they were being funded by the federal government, or what?
Well, we would pay their normal salary, and then the federal government would pay them any overtime that they would incur while involved in their activities.
Well, tell me, what does the money represent that we're having changed over, the $494,000? What is that? Is that from salaries?
No, I think the $494,000 is the difference between.
I'm sorry, I read the wrong figure. It's $806,000, is it?
Yes,
$808,000.
Right, and that is a potential asset forfeiture fund amount. We never had that amount in the account. That was just kind of how the account was set up, and so it really is on paper only a transfer from one agency to another. It's not real money.
It won't be a reoccurring expense. Okay. No, thank you.
All right, and questions from Liberty County.
Now,
always,
you know that's where I live.
I know that's why I'm really taking you. I have been researching your voting record, so I do like you.
Thank you, sir.
And I know you're relatively new in the department. real money and not real money has always fascinated me in accounting. And you know, that not real money is usually convenient money that helps something for a minute, but you can't buy anything at Kroger with it. And that's a little fascinating to me. But I hope we could we talk about real money. How many people do you release a year through pardon and parole?
In FY16, we posted 13,379 individuals that the parole board released from prison.
And when you come back on your 18, tell us how many you released. I'm trying to track this prison reform. Mm-hmm. Tell us how many released periodically leading up to about 3 years ago.
I can't do that.
Which was. All right?
Absolutely.
Thank you.
All right. Thank you, Executive Director. We appreciate that very much. Thank you for your time.
Thank you.
All right. We're going to move on now to the next one is Department of Public Safety. We have Colonel Mark McDonough. Appreciate his time.
Yes, Lance. If you notice we've slowed down, you probably won't get a question.
Well, I appreciate the not so faint at heart sticking around, Mr. Al. Mr. Chairman, members of the committee, the issue that's been addressed by everybody in law enforcement here has been the 20% pay raise across the board. You can see that our division is broken up into separate accounting issues, but we currently have roughly 1,034 sworn employees in our department. And how does it impact us? We track each one of our trooper schools, and in the tracking, we have the number of candidates that we have during that period of time. And at the 22nd week mark, between the school before the governor's announcement and now the current school that we're recruiting for, we had 852 people that were being recruited in the school before. We now have 668 being recruited now. So I think the proof is in the pudding of the impact that that has on us. Last year alone, in the calendar year 2016, we lost 116 sworn officers in the department. So this initiative is huge for us, and we can see its positive benefits already. I'd bring your attention to Section 39.1.3, and that is the request for the installation of a FLIR device for one of our helicopters. FLIR stands for Forward Looking Infrared Radar. This is the device that's used from the helicopter to find folks that are missing at night, whether they're an Alzheimer's patient that is in the woods, or a small child, or a hunter, or whether this is a convict that has run, or somebody, as we say it, has bush bonded into the bush. This is the essential piece of equipment that we use to find those folks, and it's designed to use the heat signature from them to find it. We have 6 aircraft that can be equipped with it. Right now we have 5, and this is the last one that we can put on it. Why is this important? In an aviation fleet, you want to keep your operational readiness of anything that you can use at about 80%. For instance, right now we have 5 of those aircraft. 3 of them are down for maintenance, significant maintenance. So right now I only have 2 aircraft with FLIRs in the whole state to be able to assist all law enforcement. This is one of the FLIRs that we received through grant funding through the Georgia Emergency Management Agency, and essentially it's been sitting on the shelf waiting through the years as we put them in. Nothing in aviation, y'all, is inexpensive. Just to paint a helicopter costs $200,000. With these funds, not only will the FLIR be installed, but it also includes a data link, basically an antenna that allows the transmission of the FLIR image from in the helicopter down to ground personnel. So if you're that deputy or trooper that's on the road and they're looking for an escaped convict, they can actually get a picture on a notepad to be able to see where that image is in the woods. We recently used it here in Atlanta during the demonstrations, and demonstrations are not static, they move. And so for us to be able to react to what was occurring, we had that eye in the sky, that image that was put down to us that enabled us to move where we needed to move efficiently. The other thing that's part of this installation is essentially a map overlay. so that the operator that is in the helicopter and is using that FLIR image, wherever he moves that FLIR ball, the overlay shows him whether it's Peachtree Street or Piedmont Street or Cortland or Mitchell. So if our FLIR operator happens to be from North Georgia and doesn't know downtown Atlanta, like folks maybe who patrol here, he's able to have that orientation to tell the folks on the ground where that image is coming from. A very important piece of equipment, and this is then the last string of installations of those FLIRs that we receive through grant funding to have all 6 of those helicopters be equipped with that piece of equipment. The next is 39.4.3, and that is the telecommunications request, about $915,000. That's for 50 FutureCom radios. In this state, as a support agency, we essentially chase frequencies with the other departments that we work with. In other words, a PD in North Georgia, a Sheriff's Department in South Georgia, Metro Atlanta don't all operate under the same types of radio systems, and radio systems operate on frequency bandwidths. What this particular radio does is essentially combine multiple radio capabilities into one. So whether a trooper is at a riot detail in downtown Atlanta, he can use the 800 megahertz frequencies here that we use. If he's at a sheriff's department in South Georgia that's using a VHF radio system, we can do that. Or if he's on the coast and somebody's using a 400 megahertz, he can do that. So as a support agency in a state that does not have a statewide radio system used by all law enforcement, multiple different systems, it allows us to be able to operate in that environment. The second is 39.4.4, and that is a portion of our request for new vehicles. It's a purchase of 251 law enforcement vehicles. That's specific to the State Patrol, the state troopers, and that's $11,825,000. When we look at fleet operations, we use a benchmark of 130,000 miles to cue us for the 135,000 miles that's recommended for patrol vehicles, because we are in the pursuit vehicle business. We do pursue folks, and these are pursuit vehicles that are at speeds of upwards of almost 160 miles an hour sometimes. And so that figure is what is used of the wear and tear to manage the fleet. So we project out the vehicles that are going to be at that mileage, and then project out over the course of when we receive the vehicles and we get them in the field, what is going to be at the time. When we purchase vehicles, we don't purchase a vehicle that goes on the road immediately. It's delivered by the manufacturer, and then it goes through a process in our garage where the lights, the bumpers, the cameras, the cages, everything is put into the vehicle. And so there is an overlap, a lag time between when we get the vehicle and when we can put it out there. Right now, DOAS shows that we have 1,383 vehicles in our fleet, and that's for a vehicle for all of our sworn members, and then SWAT vehicles, four-wheel drive vehicles that are in the post in the northern part of the state, dive vehicles. It includes everything from armored vehicles to the wreckers that we use to retrieve folks that their vehicles have broken down back to our garage. And then we also maintain a small pool of cars that when a trooper's vehicle goes down, we have a spare vehicle to put them back on so that they're not down because their vehicle is down. In the Motor Carrier Compliance Division, 39.5.3, it's the purchase of 105 law enforcement pursuit vehicles. What has happened in recent years is we've requested vehicles for that particular division, but we have received just a small fraction. So their fleet is very high mileage, and we have 242 people that are in that division that are sworn officers that work the road. Their needs for a vehicle are a little bit different than from a trooper, because a lot of them carry mobile scales when they do the weighing of trucks on the side of the roadway. And so, a standard police vehicle, a pursuit vehicle, a sedan's not big enough. So predominantly they use SUVs because of the equipment that they have to carry to inspect the trucks on the side of the roadway. This will be a huge thing for that division because of the high mileage that they have. Then the last thing I'd like to point out is 39.5.4, and that's the $900,000 that was put in the amended budget for weigh stations. Some of you may remember that there was an initiative by us 2 years ago to actually take physical ownership of all of those 19 weigh stations. And the reason is because the DOT own them, but it's our folks that are working in them. And the DOT does an awesome job building roads, but when you need a toilet fixed in a weigh station, it's a difficult thing to get them out there because, let's face it, that's not what they do for a living. That's right. They're not toilet fixers. So what we basically said is we wanted to take possession of them to do that everyday maintenance. Well, we've just signed a intergovernmental agreement with them. We haven't taken physical possession. They still own the title. But now we have a 20-year agreement to start doing that major maintenance and repair that occurs at those stations that we can do ourselves. Essentially, all cut our own grass because it's important to us. When the light goes out, we need to change the bulb. And so that's the reason for that appropriation. Now, because the ownership is retained by the Department of Transportation, they do have funds that come to them for capital improvements. In other words, if we have to replace one of those buildings, there are federal funds that are available to replace those buildings. Those are the things that I've highlighted in the amended, and I'd be happy to answer any questions.
Thank you, Colonel. Going to the line item 39.4.5, this is utilize existing funds of over $1.4 million for paving the roof and repair for the headquarters facility, and to fund the operational costs of 50-man trooper school. What is the source of that $4.1 million?
Last year, I told you that we lost 116 personnel. And so when you have a budget that supports a certain amount of manpower and folks are coming and going, when you take out the, annual leave payouts that come out of that, you end up with a source of funds that you can use for other things. In the past, the year before, we used those funds to purchase LWRC long guns. In other words, our troopers on the roadway did not have long guns in their automobile. And so that was a $1.5 million purchase so that every single sworn officer has got that long gun. We use those funds for things that we need. We usually do not come to you with a laundry list of things that we need because the fact of the matter is a lot of our equipment is donated by local agencies, and a lot of folks don't realize that. In fact, there was a period of time where if it weren't for in 2012 and 13 and 14 for the sheriffs and chiefs of this state, we didn't have the gas to patrol with. And so when we have those folks that are not on the roadway, we have those operational savings, we have those personal service savings, and we try to use those for our needs. Some of the needs that we have in the future is our rain gear is 20 years old. We need license scanners. If you pull out your license, you'll see that there is a barcode on it. That's done for a reason. And so that allows a trooper that's in a car with an MDT or a motor carrier officer just to swipe the license, just like your credit card. And all the information related to that license comes up for a citation or whether he's working an accident. It's an officer safety issue in modern times because he's diverted by that MDT, and if he is typing in that information or he's running it over the radio, his eyes are off the person that he's dealing with. So that's a safety issue. We have over a 60-year-old headquarters building. Folks have heard me say before, come to us, but you can't drink the water at our place because the water's not fit to drink. We're one of the only few agencies in our budget we're allowed to drink, purchase drinking water, for drinking purposes in our building. But the hall floor is shiny and we keep it painted. But there are things that occur, such as a leaking roof, and that's what we would spend the money on. And in addition, we are putting in a new facilities maintenance building. And before that's done, all of the paving that's behind the existing garage is very, very old and is deteriorated. And so when we have funds like that, that's what we try to put it for so we don't come to you with additional requests for funding.
Okay. Vice Chair?
Colonel, I don't have a question. I have a comment. You made a comment about the FLIR and the aviation aspect and how it was used in the demonstration, and it just triggered in my mind. Yeah, the FLIR might have been important, but I will tell you that I sat in Habersham County and watched that demonstration and watched your troopers, and I've never seen a higher standard of professionalism.
Thanks, sir.
And it's a strong reflection of the type of character of the people that you have in the leadership. And I was greatly impressed and very appreciative. Thank you.
We've been doing de-escalation training since 2008 when I became the commanding officer. It's something that has been inherent to all of our folks that are in the field and the folks that we train new. So, we're the folks that for SF-13 are in the business if there is civil unrest. And so a lot of what's been doing is what we've been doing for a lot of time. It's good to see that it's moving forward with everybody.
Thank you, Colonel. Just members of the committee, we are gonna have a meeting subsequent to this one in 410. So, want to make you aware of that. But also, Chairman Willie, were you here last meeting when Colonel McDonough explained the radio systems and how that worked? I don't want to duplicate a subject area, but I want to make sure that we cover that. Okay. What I wanted to ask you about, Colonel, is just to educate real time what it means to have, when you're chasing radios or chasing signals, what that means real time, and why these radio systems are important to your officers, and what that is when they're chasing a signal, trying to find a local signal.
Place yourself in a car at 120 miles an hour, and you're going from jurisdiction to jurisdiction as you're after somebody. And as you move from jurisdiction to jurisdiction, the frequencies that cover your support by either local law enforcement, and when you're in one of those things, any help you can get, you'll take it. And so if you're trying to get a hold of one county on one frequency, and then you go into the next county and you're trying to get a hold of another, you're trying to move in your radio system from frequency to frequency. And a lot of times, the way it's designed is per county or per area, there's a block of frequencies. So you have to first move out of that block of frequencies to the area that you're in, and then scroll down through that block to get to the frequency of who you need to talk to. Do all that 120 miles an hour.
And those frequencies can vary. It may be an 800 megahertz system, it may be a 700 megahertz system, it may be an old VHF radio system. So you may have not only frequencies but different mediums in which you're having to scroll through, and they're having to do this by tone.
Yes,
as well as visually.
Yes, one thing that you have to do is you have to visually go to the right place, and whether it is a push button or through rotation. If it is by rotation to get to the block, you have to physically look. And then once you get to it, as you push up and down in that menu, you can literally have to count tones if you know where you are versus where you're going to, so you don't have to look at it.
If we had a statewide radio system where we were all on the same frequency, local law enforcement, state patrol, EMS, fire, etc., your first responders essentially, how would that impact your duties, responsibilities for your patrolmen?
For everybody, it would give a common radio system, whether it was 400, 700, or 800 megahertz, that a standard radio could be purchased instead of a bunch of different radios. And so now you're going to take all of those blocks and you're going to narrow that down into a much smaller menu, and it's going to take less to be able to move from those frequencies when you're in one bandwidth or one area. So it would be something that for clear voice, for all of public safety, whether it's fire, whether it's rescue, EMS, it would really narrow it down and make it less difficult for us as a support agency to be able to move from one frequency to the next. Okay. And the interoperability of it, when you have a system that has a trunking system, you can literally have a person that is in one geographic area talk to another person that's in another geographic area completely across the state. Mm-hmm. And why would that be important? When you look at what happens in a hurricane relief effort in this state, you may have to coordinate communication with a trooper that's on I-75 with a trooper that's on I-95 for a counterflow that's going down I-16. And so in our existing system, that's very difficult for us to do that. But with a trunking system like that, they can easily go to a common frequency and be able to communicate across that distance, officer to officer, to accomplish that task.
Would that also be helpful in terms of communications from GBI and the Fusion Center?
It's no different from them. Absolutely, sir. Yes, sir.
Right. Okay. Vice Chair, you had a question? No, you're good. Okay. Our gentleman from Liberty County, Ms. Williams.
Yes, sir. Thank you, Colonel. I just wanted to say, for the sake of, we all have stepchildren we never like to talk about, but I hope we never, as a state, reach the point where you guys had to borrow gas or get gas from sheriff's departments, and we literally close down early evening because we don't have the staff to patrol. Bad guys and speeders don't take in consideration the hours nor the budget. That's something that we should always acknowledge and make sure it doesn't happen again, because we didn't talk about it near enough as a shame it was, because if we have let some other things go, we certainly don't need to have state patrol unable to drive their cars because of gas.
Mr. Al, thank you. And the legislation did take action, y'all.
It happened.
It did happen, but we did take action, and y'all took action, and we thank you for it.
Chairman Willard.
Well, we all did what we had to do during that unfortunate about 4 or 5 year period of time. I know that was a tough time serving the legislature. Don't want to go through it again. Tell me about your radio system. What is your system megahertz wise? What is the size?
It's VHF. We operate in about 154 to 155 megahertz. So it's a 70.
Is that an old system?
70-year-old system. Yes,
Wow!
sir.
Wow!
Yes, sir. We maintain.
Have you considered updating your system?
That's what we're talking about, sir. Our system is an antiquated system that has over 90 towers, and the MMR for that, and really it is so antiquated that it's good for us, but it's not good for anybody else.
I don't know anybody today, as far as local law enforcement, does a VHF system.
There are some, a
Still
lot
left?
of rural counties still do, sir.
Still rural
Yes,
counties?
sir.
I'm looking at the metro area, like we just put an 800 megahertz
sir.
up in North Fulton for that whole area. And I think, is there something you can do by encouraging the Sheriff's Association, the Chief of Police Association, to begin considering uniform radio systems throughout the state as they upgrade? Because all of them have to upgrade about every 4-8 years, something like that.
And the issue is the FCC and federal guidelines.
True.
The cost of the P25 compliant, that interoperability compliant system, is very, very expensive. So when you're in a rural part of this state, and a sheriff or 911 director is looking at those dollars, that requirement to integrate for that interoperability goes away when he looks at the dollar figure of what that costs versus what he can get for a much lower system in cost to not be compliant for that, because he's solving his problem now. In other words, he needs clear voice now. And if he doesn't have those dollars to pay for that compliant system, a lot of folks have put in non-compliant systems, which, what does that do for the overall issue? It just compounds it for interoperability, that connectivity between those different systems.
Well, it sounds like it's not much we can do as a state unless we mandate, and mandate means take care of the cost too.
If you build a statewide radio system, there's two ways that it can be done. One is a capital outlay where a particular agency would own it and manage it. Or you could do what other areas do, and I'll use South Carolina, the Palmetto 800 system. It is a system that's built, and then people are on it as subscribers. Public safety having the priority, particularly in times of emergency. And in that system, they have everybody from their power company to their meter checkers, in municipalities to their probation officers. Everybody's on that system, and they're on that system as a subscriber, and so the cost of that is spread out by the usage.
Good point. Okay, thank you.
Yes, sir.
All right. Thank you, Colonel. We appreciate that. I'd seen no other questions from the committee, so we're going to wrap up here. Appreciate the presentation. Thank you for the information on the radio system. I think there's a critical infrastructure need here in this area. I think it needs some further examination. Members of the committee, what we're going to do is we're scheduled to adjourn to room 410. Please understand that the role of this subcommittee is to review the appropriations and contemplate the appropriations to be recommended by the committee to the full committee of the House of Representatives. It is essential. Not only are we overseeing the third branch of government in its appropriations, we are also overseeing what I think is fundamentally the most essential purpose of government, which is to provide for public safety. This is a constitutionally mandated responsibility for the House. It is the only constitutionally mandated responsibility of our General Assembly, and that is to appropriate the state's funds. I encourage you to stay for our meeting at 4:10. Thank you. We stand adjourned.